Mike Moore Media, the first place to hear Rockingham County news and information.
It's our monthly podcast from Rockingham Community College. And today, Sherry Thomas, Health Sciences Coordinator at RCC. Hey, Sherry, how are you?
I'm good, and you?
I'm doing well, thanks. Well, you haven't been at RCC that long, but you do have many years of healthcare experience, so please tell us a little bit about yourself.
So, no, I recently came on with RCC this year, right before the pandemic. Prior to that, I was in healthcare for 28 years, different areas of healthcare, and I was teaching at the same time. So I've been teaching for 11 years, and I wanted to come back to the area, and I found this position was open, and I applied. So this is where I am.
Well, we're glad you're there. So you're saying you're coming back to the area, so that leads me to think that you've been here before.
Yes, I lived here when I first moved to North Carolina. I moved to this area.
Okay.
And I raised my children in this area.
Well, welcome back. We're glad you're here at RCC. What is allied health? What does that encompass?
So allied health is individuals who do things outside of nursing and doctoring. It can be like a respiratory therapist, a medical assistant, a phlebotomist. Those are different people that specialize in different areas other than nursing and doctoring.
All very popular, too, from what I hear, and in demand.
Correct.
Okay. What new allied health programs has RCC added in 2020? What have you done there?
So we started this year with medical assisting, and we've run our first semester with that, and it has gone really well. We've picked up a lot of doctors in the area that have partnered with us as well for our students so that they can do their site visits or rotations through there. We are working on 2 other programs right now, hopefully to start maybe spring or summer.
Okay. Well, we'll find out more about them in a moment. What is the purpose of your allied health programs there at RCC?
So they're short programs, and what they do is they allow a person to get through and get certified and get gainful employed, especially in like medical offices and laboratories where they're much needed right now. It makes it easier for us to put people into the field with the shorter programs, and they get the hands-on experience.
Yeah. So the demand is certainly there, isn't it?
It's very high right now, yes.
Yeah. Who employs your graduates?
So it'd be like hospitals, laboratories, medical offices. Right now, that's probably primarily what hires my allied health students.
Okay. Kind of take us through the program there, if you would, Sherry. Some of the things you're doing, you mentioned a few already, I know, but how do graduates from allied health programs get from point A to point B and gain their certifications?
So right now, with the COVID, we're doing a lot online. So they'll do primarily all their theory part online, and then they'll come in stagnating during the week until COVID goes away or until they tell us that we don't have to do it that way. They'll come in twice a week and do like skill checkoffs, and they have deadlines. And once they complete that and satisfy and complete their hours in a hospital or a doctor's office, and they've met the time and the hours that they need, then they are able to set for a certification exam, which is a national exam, and then they can become employed.
Mm-hmm. Okay. Are you looking at any particular age range for students?
I can't really say that because allied health goes from 18. I've had them as high as 70 years old, and I currently have some right now that are over 60 in my class that are doing very well. So they're usually adult learners that like this type of class too.
Mm-hmm. More male, more female. How does that look?
Well, here in Rockingham County is more female, although you do have males that attend these classes, and they do very well as well.
Mm-hmm. Okay. Are you finding, you're mentioning kind of an older age there, are you finding people maybe that are looking at this as a second career, perhaps?
They are, where they've gotten laid off from COVID or other reasons, businesses shutting down. Then they look at doing a short term. They don't want to spend a lot of time in college, so they do the short term, and actually they're very successful, most of them, those are.
Mm-hmm. You know, this has to be awfully rewarding, too, I would think. For you and for the students.
Yes. You know, the students more so. I was very pleased this time that I have not had one student that didn't go to a clinical rotation that wasn't offered either part-time or full-time position.
Mm-hmm. Well, that's certainly...
Once they become certified.
Yeah.
So, you know, is that always going to happen? No. You know, but it was very good that I thought it was very good that they all were offered positions this go-round,
mm-hmm.
the first go-round.
Sure, yeah. Well, that speaks to the demand and the need right now, I guess, too, here. We're looking at right here in Rockingham County or outside of the immediate area?
Actually, right here in Rockingham County.
Mm-hmm. Okay. Well, that shows that the program is needed. It's there and in place, and people need your graduates. That's great.
Yes, that is good.
Okay. Well, you said a little bit ago about maybe some new programs coming in the new year. We're all anticipating a better 2021. What are some new allied health programs you're getting ready to implement perhaps?
So right now, actually, we are looking at doing dialysis technician. We are actively seeking an instructor right now, and to build that class and to move into starting that program. We have secured clinical sites for that program. The other program that we're looking at starting is a custodial for allied health type class. Mm-hmm. So that would be like, those people would be like people that would come in and clean hospitals, doctors' offices. You know, they would learn not only about custodial, but like bloodborne pathogens, OSHA stuff that can help them with their custodial and protect them and others in the industry.
I'd say that's changed dramatically in the last 8 or 9 months, hasn't it?
Yes, but you know, there's a lot of things that they have in place. They already had in place for this, if that makes sense.
Mm-hmm. Yeah, I understand. Sure. Yeah.
Yeah, this just got more strict.
Mm-hmm. Yeah. Okay. All right. Well, that gives us a really good overview of what you're doing at Rockingham Community College with your allied health program. Anything else we should mention if someone is listening and they're interested in talking to you, perhaps?
Yeah, they can reach out to me at my number at Rockingham at my extension. It is, or the phone number here is 336-342-4261, extension 2791. I'll be happy to speak with them.
Very good. Before we're closing, how many students do you currently have in the programs?
Medical assisting, typically 12. Now, with phlebotomy, right now we're limiting because we don't want to, where you're welcome out right now in the laboratories where they're actually testing for the COVID, if that makes sense.
Mm-hmm.
So we're limiting our students for phlebotomy right now. We're looking to fill that program, so 10 is the max there. With the EKG, we're going to do 12, and then if we start dialysis technician, that will be 12 as well.
Mm-hmm. Yeah, and it's good you have that that ratio. Sounds like a good one-on-one combination.
Yes.
Mm-hmm.
It's a lot of students to manage when you start rolling out the programs as well.
Yeah,
and That would be every 16. Some classes run 16 weeks, and some classes run 14 weeks.
Yeah. Okay. Well, Sherry, we're glad you're there. Thank you for the good work you're doing at Rockingham Community College and getting our young people and our older people here in the county ready to go out and do some really good work to help us. And I appreciate it very much. Good to talk to you. Happy Thanksgiving.
Happy Thanksgiving to you too, Mike. Have a good day.
Okay, you too, Sherry. Bye-bye.
Bye-bye.
That's Sherry Thomas. She is Health Sciences Coordinator at Rockingham Community College. Many years of experience in the with healthcare and doing a great job there with allied health at Rockingham Community College and her capacity there. And we appreciate all of the people going through that program too, and your commitment as well. And thank you for tuning into our program. A reminder, you can get more information online about Rockingham Community College and all of the good resources there at rockinghamcc.edu.